Veronica Turner is making her rounds at Harbor-UCLA Medical Center.
Although she is not a doctor or a nurse, the care she provides can also be life-saving and many times life-altering. Turner is part of Harbor-UCLA's Homeless Task Force, an effort she helped create.
I was working in the emergency room as a clinical social worker, dealing with the traumas that come here. But as we begin to get more homeless, it was hard to kind of divide your time because you needed to give more attention to those who are homeless and make sure they have permanent placements. My goal is to, once they place, that they don't use the ER as a place to find food, a place to get a warm bed. But if we can get them permanently housed, they wouldn't use the ER as much.
One of those individuals is Annette Arrington. Once homeless and in bad health, she is now living in her own home.
So I went to the hospital because I ended up, hurting my hip. And when I finished with the hospital, I told them I didn't have nowhere to go. I slept overnight at the hospital. And then this shelter worker named Veronica, she came to me and I told her my situation, that my dad is homeless and I'm homeless and I'm in a wheelchair and I can't sleep. And so the same day, she sent me to a shelter.
We have a lot of homeless patients who come through for medical problems, but also for placement if they have complex chronic medical problems. And the Homeless Task Force comes in and rounds with us every day and identifies our homeless patients and figures out what resources they can provide them, if it's housing, if it's access to their appointments, to food, to transportation, whatever their needs are.
We came up with this brainchild of putting together a team that we call the Homeless Task Force that was specialized with a senior clinical social worker who has the experience in doing psychosocial assessments, but also having some additional support on the team to be able to help to connect the patients with the resources once we determine what they need.
A lot of people come to the emergency room when they're in crisis, and I think that's one of the main reasons why a lot of people who are experiencing homeless do come to the ER, because they feel safe. It's warm, they have bathrooms, they have people that they can talk to.
The task force includes a caseworker, a clinical social worker, a medical caseworker, and 2 members of People Assisting the Homeless, or PATH, a county-funded nonprofit provider that offers wraparound services to homeless patients.
Just really working with people from start to finish, getting them off the streets, out of the ER, into temporary shelter, and then eventually into permanent housing with ongoing long-term support.
Since it began in August of 2016, it's helped almost 700 homeless individuals with either temporary or permanent housing, or connected them with outpatient community resources.
They also work with the Department of Health Services, which created a Housing for Health division in 2013 to help move homeless individuals who are high utilizers of emergency services into permanent housing.
So this is our board of all of our interim housing beds. And these are all the sites that we have. These big letters here, they delineate a site. So when the people from Harbor, from their Homeless Task Force, call us, we look at the board and we see, where do we have a bed? What we offer to them is, when they're working with somebody who's willing to come inside, they can call us up and if we have a bed available, we'll bring that person inside. And that will be one less person who's homeless in and around Harbor, or a frequent user of Harbor, who will be on their way to getting a permanent plan to address their homelessness.
I found your shared room. Okay. Yeah, and I think it's only going to be $7 a month. You get 3 meals a day. And transportation where you need to go. Okay.
They listen. They don't judge you. That's the key, to listen to you, what you need. And that's what I like about it. They listen to me. And they was really caring about what I needed. My lady right here, without her, where would I be? Miss Veronica B. And she's still here with me through my goods and my bags.
Don't make me cry.
You see, I'm crying because I have me a place because of Veronica. You just don't know how much I've been through to get here, but I made it.
In Torrance, I'm Naiba Reynoso.